Thank you, everyone on the line joining us late afternoon if you're East Coast and tail into your lunch hour if you're West Coast. We really appreciate the time. We are going to be talking purely about 2024 and the hot topic, or one of the hot topics, and in all of the discussions we have with health plans, which is about how we're planning to drive member engagement, really in any number of things available to our members across all of the plans that you all administer. We've got a wide group of people here today. I know we've got strategists, we've got executives, we've got tacticians, we've got people from different departments. And I think as we take a look at our agenda, we're going to be able to hit on something for everybody. So a couple of grounding thoughts as we talk just about where are we as an industry in 2024? What are some of the hot button topics that we've been hearing about relative to member engagement? And also just creating a foundation for this discussion around when we talk about engagement, why are we talking about it as such a strategic imperative for all of us? We'll talk big picture strategy. We'll talk design sessions and how we're designing for success. And we'll also get right into the tactical execution, right down into looking at some specific member communications that are the output of really good strategic planning, and some of the ways that you can optimize this. So again, no matter where you sit, we hope there's something great for you here today. And before we really jump in, Sarah and I both wanted to introduce ourselves. We'll then introduce Clarity, so you know a little bit about sort of where we sit and where we stand, and that should help provide some context for our comments today. As Maria said, my name is Drew Corbett. I'm the Vice President of Product Innovation at Clarity Software Solutions. I've really spent the balance of my career in healthcare strategy, so both in a consulting capacity, working on developing innovation programs for health plans and provider systems, working in other facets of strategy, and then a lot of time directly in industry, in member engagement industry, with one of the early and preeminent member engagement platforms in Welltok and CafeWell, which has gone on to become Virgin Pulse. So lots of experience both in scanning the market and working with a lot of health plans in a consulting capacity, and also digging into the trenches and doing some of this ourselves. And without further ado, Sarah, I'll let you introduce yourself as well.
Great. Good afternoon. Thank you, everyone, for joining us. We know you guys are very busy, but excited to be here today about the conversation that you will hear. I'm going to be primarily just supporting Drew, adding in some of our experience and how we work with our health plans, just like you. A little bit about my background. I've always been in the healthcare communications space. I started out at Redbrick, which is now a part of Virgin Pulse, so that's where a little bit of Drew and I overlap, but joined Clarity in 2021. And really saw this great opportunity to look at print as not just a print for your ID card or a bill from a member, but ultimately as an engagement vehicle that could test and learn and offer opportunities and strategies for the digital side. So you'll hear a little bit about that today, and you'll hear me kind of throughout, but really primarily Drew will be leading you through the slides.
Yeah, and a voice that Sarah brings that we really wanted to lean into here is, I don't know how many dozens of calls you're on weekly, talking to regional plans, talking to national plans, and just learning what really the pulse of the industry is. So as we talk through some of the content, we wanted to make sure that this is also practical to the real world and the day-to-day and not just theoretical. So Sarah's going to be giving us a lot of voice of really many of you on the calls today. And again, I'll just use that as a reminder to send Maria your Q&As as we go through if you've got additional questions too. So for those of you that were attracted to the topic of this webinar, but really aren't familiar with Clarity Software Solutions, Clarity is a company that's based out of Madison, Connecticut, so a small coastal Connecticut town, about 18 years ago. So very established player in the industry. And for the entire duration of that timeline, we have been one of sort of the preeminent vendors and partners to the health plan industry to data manage and then print and fulfill what we think of as traditional healthcare correspondence. I've got just an example of these things up here, but when you get your ID card in the mail and whomever you have, and in your cases, who you likely are employed by for your health insurance, very likely that Clarity is the entity that we're working with you on the back end to actually do that, that print and distribution. That gives us a really interesting footprint in touching a lot of members on a really periodic basis without it being an exceptionally high variable cost from a marketing perspective. So we know that things like 1095s and explanation of benefits documents and ID cards are by and large going out to many, if not most, members every year. And that is one of the reasons that Clarity, and from where Sarah and I sit and more of an innovation department, really said, if we as an industry have this challenge of getting more visibility to great assets that can help a member be healthier, Clarity's in a really interesting place to put all of those benefits in front of members more often by way of some of these things that we do. You'll hear us talk a lot about multimodal engagement. We are definitely not of the mindset that the be-all end-all of communications occurs through these print modalities. We're going to talk a lot about text, a lot about email and so on, and making sure that these are multimodal strategies. But this is really where our footprint allows us to talk to a huge amount of membership throughout the country. And over the past few years, the work that we've done has really given us some nice insight and perspective about how to develop those engagement strategies by way of these products, which we know you all administer.
Yep. And for a majority of you, you probably think of this as just, a normal spend. Print has to go out, member ID has to arrive in the member's mailbox. But really what we're going to be asking you today is the what and why these communications are ultimately important to you, and how you can make sure that it's not just a spend item, but also there is an ROI for it.
And so when we think about what is the state of the industry right now, and just some of the things that we've heard, even in the early in the year discussions, when we're talking about communications and engagement, I would guess a lot of you would, you'd finish our sentences on these, but we're trying to simplify member communications. We're trying to more generally simplify member experience. We're trying to reach people where they are with those multimodal communications and really be more of a consumer relationship rather than an administered, sometimes in a commercial audience, a B2B2C relationship. Trying to make that feel more like the consumer experiences that we've become accustomed to in our daily lives. And we're doing so with, and we'll come back to this in a little bit of depth, but there's a huge financial imperative to this. It's not just because we feel like our brand should be a really proficient and elegant communicator. It's because we also have payment mechanisms out there. We'll pick on Stars and Medicare a lot today. But these things are demanding that the industry becomes more proficient at driving positive experience. So even if we were to look at this as pure marketers and say we just want to do better, there is also a financial imperative for health plans that we must do better. And we'll dig a little bit into that. Part of as we do so, we hope that this can be used as fodder for your internal discussions of really like closing the loop in internal meetings around here's the financial case that we need to make to be more sophisticated in our engagement strategy. But we'll dive a little bit further into that. I mentioned that we're also just going to talk about why engagement in a little bit more depth. And so high level, and we've got a couple more frames on this, but when we think about in a Medicare audience in particular, that cost or risk of attrition, we know that we have to resell every member every year. And if that experience is a negative one, then we've got challenges with that. So, those unengaged members really being dissatisfied is something that we have to keep a really sharp pulse on. And as we look at some of the data, this is from a JD Power survey from a few years ago, but overall member satisfaction can really increase just based on the communications that we're sending and the thoughtfulness of those communications. And when I think about myself as a member of a health plan, and if I were on, say, just an individual market and maybe making that decision on an annual basis, if I were going to stay with a plan or not, of course, I need to look at things like what's in network and what's not. But so much of my motivation to leave is a function of, did I have a bad communication experience? Those are the things that I'm going to remember. So doing some of the things like providing nice education resources, making sure that I understand what my financial input is to being a member with a health plan, and then also making sure that those most useful services are at my fingertips. Even if I don't utilize all of those things, being communicated with in a way that makes me feel confident is a place that helps me stick with that brand. And these, I think, are fabulous data points to look at what is the difference between a member sort of in mass who feels appreciated versus the membership that feels frustrated. And we look at some of these things just from survey data where if a member does feel like they are known, respected, appreciated, and valued, and so much of that is simply in our tone of voice, whether in, again, in-person discussions over your call centers, or as we'll talk about extensively today in written correspondence and digital correspondence, feeling that way has a positive brand advocacy. It has a tendency to have a much higher rate of staying with a plan. And conversely, which I think is really the dangerous area here, is that if we have annoyed or disappointed or frustrated members, that likelihood to stay with the plan drops immensely. So from 66% to 27% based on the feels. And that's where we might have one of our Medicare members go, just based on, again, that way that we've communicated with them. It represents a huge risk if we think that member communications are check the box, set it and forget it, versus we look at it as an opportunity to excel. And of course, if we overlay this with the competitive markets that we know you're all in, this is, if it's not your member, then it's probably going to be your competitor's member. And that's where these numbers really sort of crystallize and come into focus. So I said that we would sort of start at the top and think really as strategists about this. And whenever I'm thinking about starting a strategic conversation, we have to start with, what are the economics of this situation? That's going to help us to drive our behavior. So just a few recent pieces, I would say probably over the last 3 or 4 months here from Pierce Healthcare, but talking about how the trade winds of Stars in 2024 are not easy ones. We have fewer health plans this year that will be 4-star plans than last year, and fewer last year than the year prior. So for those that are sort of close to these economics, we know that some of the ease that we had during COVID, those things are starting to be stripped away, and we're reconciling back to a little bit more of a rigorous environment with respect to Stars. And we're starting to see all of those things take effect in terms of just how the distribution of 1 through 5-star plans is allocated here. One thing I'm also just bringing to the forefront was, this is affecting the biggest of the big. So Aetna, I think, very publicly had lost a Medicare Advantage star, and to the tune of $800 million or $1 billion. And when asked about sort of reconciling that and saying, what do you fundamentally need to do to start to right that ship and get back on track, the focus was on experience. Those things that might be showing up in CAP surveys, those elements of our star ratings that we know are based on member experience are crystal clear in the forefront of even the largest plans that are battling this. So to say that all of this is, again, that general premise of we need to have a strategy that puts us in the best position financially, and that needs to really think about our reimbursement constructs. These are just a couple of nice examples of how real that data is. So if I sharpen the lens on that and I say, okay, I get that it's about star ratings, but what does that really mean and feel like in practice? I think it's useful just really quickly to, rather than just throw out the terms, it's a 4-star plan, it's a 5-star plan, what does that really mean? And if I look at what are called the cut points of these different star ratings, and I'll focus our attention to the top left here, getting prescription drugs, getting those needed drugs, the MAPD part of our star ratings, you would have a 5-star plan that had 91% efficacy here, and you'd have a 4-star plan that had 90%, and a 3-star plan at 89%. So we're looking at 2 or 3 cut points or percentage points in terms of participation as being the difference in, depending on the size of the plan, could be tens of millions of dollars. And I look at this not as it's a razor's edge of, oh my gosh, what if we fall by 1%? I look at it as there are huge opportunities to just jump up a little bit, even with really solid practices that are touching a few thousand people, might be all the difference that you have to make. And so this is really intended to say, we've got that motivation to move up just a little bit, and anything that we can grab onto and drive a more positive experience or drive more clear communication that helps members take the right actions, that can have an outsized benefit from a financial perspective. Generally speaking, when I look at some of the specific STAR measures, and I put a sort of health plan strategist hat on, I think, well, how are we going to close the gaps on these things? And that's where we've seen a really flourishing industry of what I'll refer to as point solutions, but a lot of the digital health ecosystem that health plans have made huge investments in, a ton of pilot programs. I'm guessing if you look at some of the logos on this screen, you'll recognize the vendors here that you as a health plan might have and be utilizing, or are just starting to launch, or are really excited because they're a vendor that's going to solve a really interesting problem for you. Knowing what your plan solution portfolio is a key part of thinking about your communication strategy. We could write the nicest love letter in the world to our members, but if we're not driving them into a program that's a benefit to them and is not fortifying the strategy that a health plan in general has put together, then we're kind of ships in the night. The right assets and the right benefits are out there for members, but as communication strategists and experience experts, if we're not connecting those dots, then we're not helping our own plan succeed in the direction that it has the ability to. So all of those things collected, I'm thinking about the meetings that you all may be having, and understanding that portfolio and recognizing where there's maybe a star rating missed or an opportunity to do better. It's really important as you're developing a communication strategy to start with your what and your why. And those examples of what are the strategic objectives that we're trying to help our membership complete or take action on. This is just sort of an example collection of an output of what those internal discussions might look like for you. So one thing we know, and I know Sarah hears this dozens of times a week, is we have got to make sure that first and foremost, we're establishing a solid digital relationship with the digital tools that we've made. And then we can go on down the line from, we need to make sure that people have access to care. If there are care gaps opened, we need to make sure that there are tools applied that we can close those, condition management programs, and med adherence. This is just sort of an example of what it might look like as the output of one of those discussions when you take stock of where we tried to move the membership.
Yeah, and I'll just add that we want to be asking these questions of you because ultimately these objectives inform the calls to action that we want to include on a print communication. So whether that's a member ID card or an EOB or a text campaign or an email going out to remind you about that other message you got, it's all very important to have it be a very clear call to action. And with this, right, there's an opportunity for one message to go to all, but through the learning that we'll talk about here momentarily, it's important to understand that you can start to segment your population, therefore specific calls to action that will really help drive certain populations to do the things that they need to do.
Yeah, I think the next step for each health plan to look at, regardless of what the collection of actions is for you, to the degree that you can understand your baseline utilization, that's going to be one of the most helpful numbers to know. If you're, let's say you have condition management programs and you know that you've got 50,000 diabetics out there and there's a program available to them that only 10 members are signed up for, okay, that helps us to weight where we put our energy. And similarly across these. So the data, and this is where we found that these communication strategy conversations can be so rich, is they allow you to reach across to different departments and say, hey, we're trying to support the data that you're pulling in terms of baseline registration. Where are we at in terms of our med adherence? If we've got a new mail order pharmacy program, how many people are enrolled in that? Because we want to start to try those, bump those numbers up too. So that's a great layer on top of this, is just where are we starting from.
Mhm.
And then you can channel check yourself. So if, let's sort of play pretend and play in the sandbox and say, let's imagine a world where those are our really critical measures and those really critical actions that we want our membership to be more engaged in. What would it look like if a year from now we had 10,000 people who had taken when you see CTA here, call to action, if we had 10,000 more members in our digital adoption and just sort of engaged in paperless communications, for example, if we got people on our telemedicine app or program, if we had 10,000 more in-home assessments for some of those members, we really don't know because they have a gap in terms of their access. You can look across these, and then we've taken sort of a generalized or a conservative estimate of the value that a member participating in this action would generate. This is totally plug and play. If you feel that these numbers are too low, too high, based on the conditions you're talking about, adjust them. But when we talk about where Sarah and I are going to go with this, even if you took a much more conservative estimate, the ROI on driving these types of numbers through a nice and elegantly executed communication strategy are totally outsized. You're talking millions of dollars relative to a spend that for what Clarity supports with health plans is a requisite cost line item anyway. All of these things are going to be distributed to members. We're just talking about making them more sophisticated as you all can, to the tune of driving this value up. And of course, if you're doing this in other modalities outside of your print correspondence, all the better. But it's again helpful to say, we're asking members to do these because it's in their interest and it's in our own financial interest as well. We've spoken generally to this, but I think especially with Clarity being, we personally are heavily invested in this last line item of the direct mail. Increasingly, we're invested in being more multimodal in our support for health plans with email and SMS. But the point is not about the modalities that we service. The point is that these are all the modalities that your members might be reachable through. So whether you're going to do less of this through direct mail, more through outbound calls, more through social media, you have to make that decision for yourself. I think the more important perspective on this is, as communication strategists, we can't have something be so important to a member when we reach them through this touch point, but when they call the call center, there's no recognition of that. And so this is an incredibly easy slide to look at, but it's an incredibly difficult sort of effort to take on to make sure that all of these communications sing in chorus. But it is worthwhile taking stock of, what does our footprint for outbound calls look like? What does our automated call and sort of outbound automated calls look like relative to direct mail, et cetera? Coordination is what your members will feel, and a lack of coordination is what will make them say, oh my gosh, this feels like it's run by 100 different people who are all pinging me to get in touch, and there's no real connectivity or chorus to it. So just a reminder, but also a nice frame to say we have to do these things in concert here.
Yeah, and a hybrid, right? There's no one silver bullet. You can't just over-index on email or just do print. It has to be a combination of several, and that's where I like looking at the coverage potential as well as effectiveness. That's where we spend a lot of time with our plans. Again, even if they're not doing email or SMS with us, we learn a lot through the print channel that informs those other channels, and vice versa. So definitely good as a takeaway. If you're going to take anything, just make sure you bring this information back to your teams. It's definitely a good one.
Yeah, it's also, I mean, as you're saying that, Sarah, it's the right tool for the right job.
Yes.
The outbound calls may have a very low coverage potential, but they also can be maybe one of the most personal that reaches someone who really, for example, has a care gap to close. So maybe that's the right tool in that situation. Doing something like email is obviously going to be the most cost effective across a mass audience, but isn't going to have the exact same efficacy that it drives. So all of these things, again, they're just members of the team that all play together. So in addition to just what the collection of actions might be, it's really interesting to also think about what is the cadence and the ordering of those actions. And I think this is another internal conversation that can really drive some healthy prioritization and drive alignment, is if we say, one department might be exceedingly positive on the mail order pharmacy program, but if we take a step back and recognize that that instrument can get played too loud, we need to do this in, again, that sort of coordination. It helps us to establish that maybe digital adoption is where everybody needs to start. And until we establish that with a member, we're going to say the other actions aren't going to be priorities yet, because we need to establish that baseline really, really high as an efficacy within our membership base. And after that, we're really trying to drive 100% adoption towards the new telemedicine program that we're excited about. And thereafter, maybe you have branching logic around in-home assessments are more relevant for some folks. Mail order might be more relevant for certain prescription drugs that are signed up. But it can sound like a lot of people shouting in a room, which I promise you your membership will feel if these things aren't done in sort of a methodical way. The other nice thing about this is it helps you to design less of a transactional approach with your membership and more the ability to say, we've got maybe a year in the life of a member and how that experience might go from participating or signing up for one thing and on to some of these different programs. So really healthy construct to have with internal discussions if you're thinking about A, what are the actions we want to drive, and B, in what order is it important for us to drive them. And so to just illustrate that with the member journey, I won't read through this piece by piece, but this is kind of the blend of what are the outreach methods that we're presenting to Maggie here? And then what are the actions that she is periodically taking? You'll notice that we're not getting a one-to-one hit rate of if we ask, she answers. Sometimes this involves a few different pieces of communication, but over time, you might see a member move if there really is a concerted effort and a thoughtful approach to how materials are presented to Maggie and the right value propositions are there. We might see a member go from totally disengaged with the health plan to they've signed up for e-delivery, they've gone paperless, and they've downloaded the app. Huge, huge step if that was the only thing you did. But now once we've got those tools in place, it's a cumulative effect over to we might set up the telemedicine app because we've got more communication about how valuable that is. We might be able to have an in-home assessment because we have a work schedule that doesn't accommodate a physician visit, but that helps us get on the radar from a pre-diabetes perspective that can ultimately lead us into a prevention program. Again, this is a little bit happy path, but it does just represent that if these things are done in an order, we can see Maggie saying, this was actually a pretty productive year in terms of what I got back out of my premiums and what I was getting back from the health plan. Okay, so we've kind of talked strategy, big picture, and now we want to talk about the approach that we've seen be really effective in terms of creating communications that are thoughtful and respectful to an audience and where they're coming from. And then writing things or penning things that are relevant to their situation. An easy way to cut this just at a high level is say, well, what market are we even talking about? If we're more or less carbon copying I'll use a welcome letter. So we're sending a new ID card and a welcome letter out to a member, which many of yours experienced over the course of the past 8 weeks here. With the tail end of the open enrollment period and new materials going out. If that message sounds the same for commercial members as it does for your duals, as it does for your MA population, there's a ton of opportunity to sharpen what that communication sounds like and get more resonance. So some of just the basic principles here, but if we're sort of focusing more on value and authority and clarity with the Medicare audience, if we're focusing on convenience and simplicity for those folks with families, these are different words on the page. And it's important to do that just with the context of, I'm not going to go through all of the little attributes on these, but there are, of course, and if we're putting our marketing hat on, real differences between how we respond if we're in one demographic population versus if we're in another. And we know this as general consumers. I'm just now thinking about like watching ads for the Super Bowl recently, and you can feel who's being marketed to if you're watching right after the halftime show versus if you're watching late night TV somewhere. Like these things are very curated as we know for consumers. But when we start to draft health plan correspondence, it seems to be something that we give ourselves the liberty of forgetting. And we're sort of here to tap the industry on the shoulder and say, it's really important that we talk to seniors with respect to what motivates them, with respect to the very changing nature of the tech savvy within the senior population, and so on. And conversely or similarly with the commercial audience, respecting that a huge amount of those people, even if we were to look at different age cohorts by decade, but very likely we have family dynamics here. And so we're not only talking about the member's care, we're talking about the member as a caregiver. And how does that shape the way that we're actually writing a message to someone, how we're acknowledging what the challenges are in his or her life, knowing that they have these dynamics about they're sort of a CFO for the family. They're also a chief medical officer for the family. They're trying to run all of these things, and are we meeting them where they are on that in a different way than an MA population? And finally, with Medicaid and duals, again, a lot of, I think a lot of challenges to assumptions that we have about communicating with this population, but gets really, really market specific in terms of, I know in particular, I've done a lot of work in Southern California where you're going to have endless amounts of dialects and you're going to have so many different languages. And so we need to communicate maybe more through iconography here than we would in a place that has sort of a more singular population from that standpoint. But the same point remains, know who you're speaking to, and you're going to speak much more elegantly to them. So what does that look like then? I mean, we've talked a lot about meet people where they are and use tactics that are relevant to where those people sit. Clarity is a big believer that correspondence is ripe to be introduced to behavioral science in a really mindful way. I think if any of us are sort of sitting down to write prose to one of our members, we might sort of peripherally think about this and try to write in a compassionate way. But introducing specific tactics is a great way to start the meetings about what does our member correspondence look like. So who are we talking to? And I'll use that MA population again. If we're talking to a Medicare population, I've got an opportunity to maybe use authority, which is right here at the center. The American Medical Association says that your annual visit is one of the most important, whatever that might be. That's going to have a really strong impression on that age cohort. If I were alternatively going to write to that same population with peer pressure here at our bottom left, that's been shown to be a total off-putting no-no for that same population. But it's really effective if we're talking to people in their late 20s, early 30s. And so pulling these things off the shelf for the right audience, not just in a it feels like the right letter way, but to actually specifically institute some of these behavioral principles into communications is a great way to know that you are at least deliberately attempting to meet the membership where they are. And we'll talk about how you can then know if it was effective or not. A/B testing is a tactic that I know is not new to the general communications industry. But again, when we think about the millions or tens of millions of pieces of correspondence that might be going out to health plan members a year, for some reason, we give ourselves a pass on utilizing this and really using it to be optimal in terms of driving engagement. Clarity has done a lot of work over the past few years with just saying, what if we just put an alternative version out? And what if we just carved off 5,000 members and looked at the way that two different versions of a letter were put together, both of which ask a member to take an action. But when we do these distributed versions, we might find that some are much more effective at driving engagement than others are. So the reason this is valuable to do, and especially as we sit here in February with a long calendar year ahead of us, if we do some of these tests over the course of the next 3, 4, 5 months, we're going to have great data that tells us next open enrollment period, when we need to distribute communications to hundreds of thousands of people, we are doing so with empirical knowledge that we're going to drive a lot more action because we're using a more effective version of that exact same piece of 8.5 by 11 paper. And this is really the opportunity we feel like is undervalued in the industry. We've got plenty of eyeballs all over these assets, opening up those ID cards to put them in their wallet. And we're generally speaking not asking, hey, did you like the way that I spoke with you in this letter? And if you did, then as a health plan, we can do more of that in the future. That's a really nice opportunity that, again, are part of the conversations that we think should be completely native to communication strategy.
Yeah, so part of our limited time today is we can't talk about kind of the analytics behind measuring the effectiveness of these communications. But I will say that we do spend a lot of time with the plans, not only just talking about how do we test different versions, but therefore how do you measure that? And I know at somewhere in the plan, someone's looking at the registration rate. So we spend a lot of time helping the plan go find and navigate to get that information, and then ultimately enhance that information over time. So even if you are just optimizing one version, looking at version A as a baseline and then understanding 6 months from now how effective that is, that's a big difference from where you were a year ago. So the A/B can seem complex and can be sometimes, and sometimes we even add a C, which is great for variation. But ultimately, we want you guys to be doing an A. We want you to be testing and learning from the communication that you are spending money on and sending out to members.
Yeah, we'll talk with clients all the time, and Sarah and I will say to each other when we're prepping for client meetings, if there's no measurement happening, the most important data point is the one first data point. And if you learn nothing else, but we get a 10% uptick from whatever we ask of members in our member communications, that is a great way to say, okay, now we're going to start testing to see how we can get to 11%. And again, for those on the phone that are really born and bred marketers, you're around the data all the time. Of moving from 10% to 11% or 1% a year is a huge deal. I mean, when we look back at the competitive environment and what the star ratings look like, if you're improving by 1% a year and your competition across town is not, I mean, you could be 5%, 10%, however further along in terms of your member engagement, without really doing all that much differently. It's just sharpening that pencil on the practices that you've already got in place, the vendors you've already got in place, and getting more out of those. But we couldn't be stronger advocates of measure whatever you're doing, because if you are doing that year over year, you're going to find these incremental improvements that someone who's not measuring is simply leaving on the table, and that can be the differentiation in your market. So we promised that we would go from the big picture and the economic drivers and stars and so on down to the really tactical. And so we wanted to walk through a real life example of if we were speaking with a health plan that said, we've got this new mail order pharmacy program, we've got to get our prescription drug adherence up. And so we're trying to bridge the gap of driving engagement and adoption to this new program. How would we come to the table and sort of facilitate that conversation? And we're going to start with barriers. Rather than here's what I want the member to do, let's think about what we're asking them to do and say, where might they have concerns or barriers around that? And what are the sort of like human levers of those barriers? What does that feel like to the member if I ask something of someone? We use the MA population, and if we were to just say to a member on the street, which I think is a great role play to do this, hey, I would love it if you would join this great new program that we have for you. It's going to deliver your meds right to your door. You'll never have to go to the pharmacy again. You won't have to commute, etc. what might some of the feedback be on that? Now, you could take this as far as focus grouping it, which is a great idea too. But even just amongst yourselves and maybe asking friends and family, you can start to get to some of these things like a lot of members like talking to their pharmacists. One, there may be social interaction there. And two, they may just have that validation of, hey, I just wanted to run by everything I'm taking from you, even though I'm picking up this one prescription today. That might be a valued relationship. And so that would be a barrier to moving away from doing in person. How do I know it's safe? Is this really just a program that is going to end up costing me more money, or is it truly a value add to me? This is going to be too much work for me to administer. And even things as practical as, what if somebody swipes these from my front door? I would, if I didn't have my medication for even a day, that could really be detrimental to me. And what we do is just accept these as they are. We can't pretend that they're valid or invalid. They represent how a member might feel. And they allow us to say, one, it stress tests what the answers of our program are to some of these things. Do we have good responses to these? But it starts to allow us also just to map. Okay, if somebody were to say, I like talking to my pharmacist, you might mention that you can still talk to a pharmacist anytime, and that the actual distribution of those medications has nothing to do with your ability to access that conversation. You can sort of go through and see these, but it's this mapping of, we actually have a pretty good perspective relative to any of these barriers that we've got a leg to stand on. We can tell the member that we appreciate those barriers, but they're ones that we really think that we've thought through, and they don't need to be concerned about this. Now, is this going to drive 100% participation in this program? No way. There are always going to be people who won't adopt something. But if we were going to be at 10%, if we had done none of this, and now that we've really done this process of addressing and breaking through barriers, maybe that puts us at 12%, at 15%, at 20%. That's the kind of incremental improvement that we're doing, again, without having additional cost or lift. It's just leveraging whatever your communication suite is today and including some of this thought into it.
Yes, we want to make sure there we go, show you how this is applied. Also know we're running out of time, so we'll make sure we get through the next little bit of information, and then I know we have some questions to answer.
So when you think about a piece of communication, and again, we're picking on a print piece here, and this might be the ID card, the welcome letter, but again, in the back of our minds, we're trying to drive this program. It's easy for a member to just read the content and say, okay, I've got the information here that they presented to me. As strategists, it's our job to say, what have we layered in here to make this thoughtful and a communications piece that really has the optimal chance of driving engagement? Again, if you were to place those measurement conversations up against this and say, A, B, C, D, E, here's what we did and what we included to try and address barriers, and we measure and find that has a 10% participation rate in the call to action, we are now starting to get smarter about how we communicate with our population. And we can do it a little bit differently next time and see if the numbers go up even further. So we wanted to close with this because we know that oftentimes these strategic discussions really, they don't lend themselves to the practical, but screen cap it or do whatever you like with this, but we think that this is a really helpful way to start introducing this into sort of functional weekly meetings.
Yeah, and we can answer, sorry, if you go back to that version, Drew. Yeah, so the first question, can you elaborate on how to direct members to URLs and printed materials to avoid losing track? So up at the far right corner, you'll see what's called the Johnson box, and we often put in QR codes. So again, everybody knows this coming out of the pandemic, and we're still using them at local restaurants, scanning and using QR codes drive members directly into that URL where they need to go. And we like unique URLs because that helps to then track, did Drew register or did Sarah register? So QR codes are awesome. They allow us to be sophisticated when it comes into print. And again, we can quickly direct the member into either a registration opt-in and or directly into a program. So we use QR codes. We test QR codes frequently. And then the other question, I think is the third one, how can we effectively measure member experience doing outreach programs, particularly in terms of engagement. I'll try to answer this, and if I'm not answering it correctly, please let me know. But part of measurement is tied into different areas that we want to include here, right? So measuring that QR code, measuring, did a member go do something, including a phone number? Did a member go call that phone number? There's lots of data that does exist at the plan. Is it all put together and represented under an N of 1? No, but we spend a lot of time with our plans, understanding what data they have available to them today, and or could we go get that data from another source? Earlier, Drew was mentioning the partner strategy. We work a lot with your partners because they often have data that we can leverage to know, did they register for that program or where are they at in that program? So we are working on developing that strategy. I will say it's definitely complex, but it's definitely a component to how we work with our customers.
The other question I saw come in is a great one. And Sarah, I would guess you have comments on this too, but do you have recommendations for aligning with diverse stakeholders to define success, especially when different departments have varying definitions for engagement?
Yes.
Yeah, go. You take that one first.
Well, I was just thinking in my head, I'm like, normally we offer to buy people donuts, and that usually works to get everybody in one room. But it is really a part of that, right? It's understanding how to cross the hallway or work with that person that lives in another state to get information about what they're working on and doing. Strategic objectives are at the plan level. And so we want to make sure at the plan level, we're then pulling different stakeholders to that conversation. Often we schedule executive business reviews. So that looks like understanding print world, but we want that customer experience marketer at that meeting. We want that quality star specialist included in that conversation. So we spend some time within the account management strategy, learning not just our day-to-day contacts, but where do our day-to-day sit and how can they be successful? And that's getting to know others in the organization to help with the strategy. Now, the strategy can be print, but outside of Clarity World, again, we learn a lot through print that informs other strategies. So we want to always package that information for that to be shared with different leaders at different meetings as our key relationships are going and having broader meetings. But we spend a lot of time working with the plans to figure this out. It's definitely a hard nut to crack.
I would say another place that can sort of normalize the definitions of success, and I think there's such a benefit within community health plans, regional health plans, to being able to do this effectively. Go back to a recent town hall reporting. And a town hall reporting will typically have, here's what we're focused on. And that can be a really normalizing discussion to say, this was brought up. This feels like a strategic goal that we should all be coalescing around. I think just to offer like one example, that's a really nice way to say, we can all agree that this is important, because when our CEO was talking about it 2 weeks ago, it was mentioned, extensively. I think that's a good place to go. A couple other comments we'll try, and we know that some people might be at time, but we're happy to keep taking these as long as Maria will let us. This is great info. It's also a little overwhelming. What are the initial steps? Where do we even start? Without knowing your exact background, it's a little bit tough to answer, but I think start with asking the questions. Where are we now, and where do we want to see our membership in 12 months in terms of what they're participating in? And if we go back to some of the initial discussion Sarah and I had, it's if we don't know where we're trying to go, what the North Star for member engagement is, what we're trying to engage those members to do, it's going to be really, really murky when we try to get into the how. So I think, if nothing else, if a department knows that, I'll use the example on the page, boy, are we trying to get people into this mail order program. Everything can come from that. And I would then say, don't be shy in terms of, as Sarah said, reach across the hall. The clinical quality folks might not think that they have a ton in common with the member communications folks, but there's so much shared space there. So I would use those prioritized actions, and that might look like some of your portfolio of partners, but use those as one of the initial steps. I'm going to close on this frame because we as we take questions, but if there are additional and ongoing questions, we're happy to just take kind of the inbound emails and have chats if that's useful. Maria, you want to cut us off?
She's
Wow, 3 more minutes if you want it.
Okay.
We'll take it.
We'll give this one to Sarah. In the context of program optimization, how can rates be improved and what steps should be taken if optimizations are required?
Yeah, so I'm going to say let's narrow it down to an example of optimization. Again, we talked a little bit about understanding a baseline. So a lot of times we talk to a plan and they say, we're doing this. And we're like, great, what have you learned? And they can't tell us. So we want to go help you find that initial number. And it's okay if it's 5%, because guess what? More than likely, you and a lot of your cohorts are in the same category of that baseline. And so we want to start there. And then again, we choose one program, one version to optimize. So we start small. Walk, crawl, run, or sorry, crawl, walk, run is how we normally do it. But working into ways that we want to test and learn, starting with one version, extending it to more, and building on that complexity. But really, if you're not learning yet, that's where we spend a lot of time, is helping to establish test and learn opportunities with you. And again, not just through the print channel, but across different modalities that you're sending out to membership.
All right, and friendly reminder that you can ask and write your questions through the chat box. And we have 1 minute, a couple of minutes to answer 1 or 2 more questions.
Yep, don't be shy. I'll just add, a lot of the time that we spend in the test and learn space with one plan, we are generating campaigns and test and learn opportunities across all our clients. So we are not shy in connecting our clients to one another. So even if you do have questions or are faced with a challenge today, I will be looking at these questions and I'll probably take it back to a plan that has the same problem as you, and be asking for their input. So we do spend a lot of time pulling our plans together, like this organization as well, making sure that we're having shared learnings, because really one plan, test and learn, is very similar to another. And as we all build on that together, the more momentum and ability we can create.